So now moving on to nausea. So two major kinds of nausea I want to address, the first being chemotherapy-induced nausea, and the second being nausea due to really other factors that we see in cancer. So chemotherapy-induced nausea. I think this is one that patients and families are very, very familiar with. It's something that we know and expect due to chemotherapy. And we see the anticipation of it through the different anti-nausea protocols that are incorporated into chemotherapy administration. So really, just to say a little bit about why this occurs, why chemotherapy as well as other drugs cause nausea and vomiting. The first is that in the brain there is a center that has a lot of receptors for different chemicals that's called the chemoreceptor trigger zone. And it is the zone that activates the command center for vomiting. In a prehistoric sense, this chemoreceptor trigger zone really is designed to help the body kind of throw up and get rid of toxins. And so those different drugs will trigger that zone. It's kind of a very primitive explanation, but essentially that's the function that this area serves in the brain. The other way that chemotherapy induces nausea and vomiting is that it can also cause disruption in the gut lining, etc., and that can also cause this response. With regards to the chemotherapy-induced nausea, there are two types, the acute type and the delayed type occurring days after the administration of the chemo. This is the type of nausea that we see and expect with regards to the administration of chemotherapy. In lung cancer, the big culprits are really the platinum agents, carboplatin, as well as cyclophosphamide and doxorubicin. So there are the other agents that I see that are more moderate in their nausea-inducing effect are Alimta or pemetrexed and Camtasar or irinotecan, as well as Taxotere. In terms of nausea unrelated to chemotherapy, there's multiple causes that we see. Other therapies can also be responsible for this, not just chemotherapy, but radiation therapy, for example, if a patient receives radiation to the gut, or if there's obstruction in the intestines or very severe constipation. You can imagine the response if the gut's not moving food and liquid and things along, and then things kind of get backed up and are going to come back out. Swelling in the brain could be related to a metastasis. That can cause nausea and vomiting, and even pain, if it's not well controlled, can also cause nausea and vomiting. To a certain extent, we also see nausea from side effects of other drugs, such as pain medications like opioids, though that is usually something that extinguishes or goes away after a couple of days on the medication. So in general, with the other causes, we do try and target therapy towards the underlying cause. And now this next slide is quite a busy slide with the different types of medications and the classes of medications used for nausea. But I put this there to emphasize that not all anti-nausea medications are created equal. So each of them will target a certain type of cause or biochemical process that's going on in the body that's causing the nausea and the vomiting. So the first group is the one I think that most people are associated with, which is the 5-HT3 antagonists. And this group people know as kind of the TRON, so things like ondansetron or Zofran, Kytril, which is known as granisetron as the generic name, and then Aloxi, which is the newest generation of this group. The generic name is palonosetron. So this group is very good for chemotherapy-induced nausea and vomiting and directly targets that area in the brain I was just mentioning. It is also a good group of medications to use when someone has bowel obstruction because it acts on those types of receptors in the bowel. And the next group is the NK1 receptor antagonists, also another group of receptors involved in that brain center. The primary agent we all know about and are familiar with is called Emend. Prepitan is the generic name. And again, this is good for chemotherapy-induced nausea and vomiting. Now, I'm going to get into other agents at this point that are used for nausea related to other causes primarily. So motility agents. These are agents that help the gut move things along so that the gut's slowed down from medications, etc. Reglan, or metoclopramide, is the prime example that people commonly use. Antihistamines, which I think people immediately associate with allergies, but there are histamine receptors in the gut, and also with regards to the brain. And so medications like Phenergan or promethazine and Benadryl are very good for nausea that's due to brain involvement or swelling, as well as opioid-induced nausea, because sometimes opioids cause a histamine response or this flushing, just like someone having an allergy. Steroids, they're kind of a big hammer hitting nausea because they act in several different ways. They're anti-inflammatory, so sometimes they help decrease inflammation in the gut, and that helps decrease nausea. They can also stimulate the appetite. The next group are the benzodiazepines, and these are medications that are particularly of use for anticipatory nausea, or nausea that may come from kind of this anxiety associated with the administration of chemotherapy, for example. So Ativan is the prime example that we see most commonly and is sometimes used in chemotherapy protocols. The last group I want to mention here is more of a hodgepodge group, but the dopamine agents. And so, again, dopamine is a transmitter that we see acting in the gut and in the brain. So compazine is the most common example, and it's one of the older medications we have for nausea, and Zyprexa, which is a newer medication. The generic name is olanzapine. In terms of other treatments we have for nausea that aren't in the same class as medications, as I mentioned in the prior slide, the first is Marinol, which is the medical form of marijuana, and this applies for medical marijuana as well, that it's considered kind of a twofer for both nausea and appetite stimulation, so it kind of can help two things at the same time. Acupuncture has also been demonstrated in trials to give some benefit for the treatment of nausea. Behavioral therapy, relaxation therapy also are both approaches that are non-pharmacologic, non-medication-based that can also help treat nausea.
Thanks for listening. If you like and learn from our GRACEcast, you can subscribe on iTunes by just searching for the term Cancer Grace, find podcasts in the subject you want, pick a format of audio or video, and then just click subscribe. It's that easy. And for those of you who don't want to miss any of our programs, there's even a feed for all subjects. You can also find us on YouTube at Grace for Cancer Info, and that's the number 4 in one word, Grace for Cancer Info. Finally, if you haven't been there yet, please check out our Grace website at www.cancergrace.org. And don't forget that donate button in the upper right. Our content, which helps tens of thousands of cancer patients around the world every month, is made possible by your support. Thanks again.